Let's talk about weight loss. What do you do when you've tried everything? Exercising, dieting, and even other lifestyle changes, but nothing is working. Medications like Ozempic, Wegovy, and Mounjaro could be the answer. The weekly injections are delivering incredible results for patients who are struggling to shed pounds. Solutionaries is working to find everyday solutions to problems like weight loss. We're going to look at the evidence that this solution actually works and also talk about the limitations. Stephanie Parris has been using Mounjaro for weight loss since January.
I'm Stephanie. I'm married to my husband, Jacob. We've been married for almost 5 years now, and we have a daughter who will be 4 in September.
We reached out to you, our viewers, to find out what questions you may have about the drugs, how they work, and whether or not they're working for you. Stephanie was one of many who told us the injectable medications have changed her life. Her family is always spending time outdoors, and since starting the medication, she feels more like herself.
So I've always been very small my whole life, very petite, never had a problem with weight. After I got married, I was in like the 120s and I was, about 30 years old. But after I had my baby, I got pretty close to my pre-baby weight. But I noticed I had really, really, really bad anxiety. My confidence was as low as it could be. Thinking of me in a bathing suit, even a one-piece, was just cringeworthy.
When did you start talking about injections like Ozempic to help you lose weight?
I saw it on social media platforms like TikTok and stuff like that, but someone I grew up with, I think she was probably like the first person that I saw a huge change in.
And you said you started in January, so what's your weight loss progress been like 6 months later?
I'm 25 pounds down. My clothes are much bigger on me, my energy levels are up, so I feel much better.
So how do the medications work, and are they safe? We went to ThinMD Med Spa in Jacksonville Beach for those answers from Dr. Anthony Capasso. He's been studying weight loss and perfecting treatment for his patients for the last 17 years. Dr. Capasso believes weight loss is personal. He offers customized weight loss plans for his patients based on their goals, and that can include weight loss shots.
There's a little difference between Mounjaro and the Wegovy or the Ozempic. So basically, it's a way of increasing the natural chemicals in your body that suppress your appetite so you don't feel like you want to eat.
Semaglutides were FDA approved for weight loss in 2021 under the brand name Wegovy. It's also available as Ozempic, which is the same medication but sold to treat type 2 diabetes. Mounjaro is slightly different. It's a tirzepatide. The injectable pen was FDA approved in 2022 as a diabetes treatment and could soon also be approved for weight loss. Dr. Capasso says it all works by mimicking a natural hormone in the body that helps regulate blood sugar, digestion, and hunger. So is this a good solution for weight loss?
It's been one of the best solutions that I've seen in 20 years. I've had patients that I didn't ever think would lose weight and did, but it has to be monitored and it has to be done by, the people that understand that.
Dr. Capasso strongly recommends patients are monitored by a doctor when using these injectable weight loss medications because there's a risk of muscle loss, and the side effects can be intense. Some users say they've admitted themselves to the ER because of severe nausea and vomiting. One lawsuit claims that the drugs can even cause stomach paralysis. Dr. Hussein Abbas is a weight loss specialist and director of bariatric medicine at HCA Florida Memorial Hospital. He says paralysis can be caused by undiagnosed illnesses and by a patient's diabetes. He is not worried about this being a common problem.
Could these medications cause gastroparesis in the long run? There's no data to suggest that right now. Unless there's something that's unpublished and I'm unaware of, these have definitely not been published so far.
Catherine Jevaleva, a pharmacist practitioner at UF Health Jacksonville, agrees. We took your questions to her about the potential downfalls of using the injections and whether the drugs are a long-term solution. There's also concerns about buying the drugs online or on social media. So what are the side effects of using these drugs for weight loss?
Stomach side effects. So you'll see lots of nausea leading to vomiting, heartburn, acid reflux. So these medications are usually started at a very low dose to get your body used to it, and then they're titrated up slowly to make sure that you're tolerating the medication well.
People are seeing things online, on social media, and even getting targeted ads for using these drugs for weight loss. So the question is it safe? I mean, especially when you're getting it online through God knows who.
They're actually not giving you a prescription, they're giving you their own made semaglutide or liraglutide. So they're getting the actual compound and making it themselves. So you have no idea what is actually in there. They're telling you it's semaglutide, but you don't really know for sure.
Do we know enough about the long-term side effects of using these drugs for weight loss?
I think with all of these medications, you have to stay on it to maintain the weight loss.
So it's not a long-term solution?
At this time, I'm not too sure, but it seems like not really.
But you can use it as a kickstart to your weight loss, right?
Yes.
And changing your habits will help those results, kind of stay more long-term.
Exactly. So lowered portions, knowing when to stop eating. But with Wegovy and Saxenda, you'll just eat less because of that increased satiety.
So what should you do if you want to start using these drugs for weight loss? Number 1, see a doctor. This can be your primary care physician or a doctor at a med spa, like Dr. Capasso. You should also get your blood work done. This is crucial to ensuring you can safely use the injections without placing any extra stress on your body. And follow up regularly. See your doctor once a month to monitor your weight loss and adjust your dosage as needed to optimize your results. You should also call your insurance. Some insurance companies will cover the cost of these weight loss drugs, but if they don't, things can get expensive fast, so be prepared for that. What does the out-of-pocket cost look like for your patients?
It depends. I have some patients that they get to use the coupon. I don't know how, but they do, and they'll pay like $200 or $300. But if you pay without the coupon, it's thousands of dollars a month. And I think what makes this so life-changing is if you look at the history of the other weight loss drugs available, their weight loss was pretty small. It was about 5-6 pounds, and now these drugs have come and people are losing 15% of their body weight. I mean, that's pretty huge. And so I think that's probably where this popularity came in, because it's pretty much revolutionized weight loss drugs.
Back to Stephanie. She plans to continue using Mounjaro to achieve her weight loss goals. For her, the side effects and the costs associated with the medications are manageable and worth it. Would you recommend someone else who's struggling to lose weight try this?
100%, yes.
People call it the easy way out.
It's actually not the easy way out because there's a lot of side effects that come along with it. But when you're really struggling with your weight and you can't succeed another way, like I tried for 3 years solid to lose weight and it just wasn't working.
This has bettered your life.
Yes, 100%, yeah.
For Solutionaries, I'm Tiffany Salome.
We'd like to hear what you think about the topic. Leave us a comment below. And be sure to subscribe to our Solutionaries channel. We're just getting started.